This is breaking news.
You've been watching a press conference by Mayor de Blasio. We're now going to switch over to a press conference being held by the United Federation of Teachers talking about the upcoming school year in New York City. Let's go to it now.
Experts, parent leaders, citywide political leaders, community leaders, and national leaders all to endorse this report. It is time for New York City to put forth a transparent, clear plan under the guidance of medical experts so that parents and teachers who have been stuck in this fearful dilemma of how to make an informed choice, so that we can tell them what the expectation is for every single school in New York City. It is time that all city schools receive the same support and meet the same criteria, so that all children, all teachers, all parents will understand whether their school is ready to open safely in the health challenge that we all face. So I'd like to bring up the graphic now of our school safety report. We're trying to keep it simple, but each one of these categories has a lot of things inside of it. The first thing is the supplies, what happens at the school building, the ventilation, all of the things that we have agreement, most of the things that we have agreement on now with the City of New York, all have to be in place in each and every school. I can announce to you all that the UFT has over 100 trained staff members who are right now, as we speak, are visiting schools to check the conditions in terms of the ventilation, the PPE, the cleaning supplies, and all the other equipment that needs to be in place. If a school has all of those things in place, in terms of that, they get a green check mark. Then after that, we need to make sure that each school has a proper plan, not a bunch of names on a list, that there is a plan for all of the procedures, how children are going in, who's going out, which way they're getting onto their buses and getting to public transportation. We have to make sure that if there is a problem in a school, someone with symptoms, that the procedures are in place, that there is a nurse there, we have an isolation room, that everyone understands their roles, that each school will now have a COVID building response team, that the school will act as a team. If a school meets both of those and gets the green check mark on both of those criteria, it would then move into what we're calling the screening and testing phase, and not before that. In the screening and testing phase is that every single person, both adult and child, who is to enter a New York City public school must have evidence that they do not have the COVID virus. And that means that we are strongly recommending at this point in time for all adults and for all parents to first consider going for an antibody test. The antibody test gives us much more assurance. We would say our position at this point is that we would recognize that test for positive antibodies for 2 months. But if you do not have positive antibodies, then within 10 days of a school opening, that you must go for a COVID test and have a negative result before you will be allowed to enter that school building. Inside of each of these categories, as I said, there are numerous different things that have to be met, but most importantly, we're trying to keep this simple and transparent for all the parents and the teachers once again. We don't need a hotline to be set up if there is a problem. We want to assure the parents and the teachers that things are already in place before they enter the school. We don't need a hotline to be called if there isn't a person to handle someone with symptoms that are demonstrating COVID-like symptoms inside of a school. We need to make sure that that's in place beforehand. And then once we have all of the screening and testing in place, we then have a baseline. And then at that moment, that New York City must have a rigorous and extensive testing and tracing program, specifically customized for its school system. What happened in March cannot happen again inside of this city. We owe too much to the communities that have suffered so greatly. But we also owe it to them to give them assurances that we're doing everything as a city, a complete community, coming together to say that we are here to support and hold our schools, the most sacred asset of every community, safe. So we are asking the mayor to adopt this school safety report. It is time. It is time. We can no longer have parents and all those who work in schools suffering, trying to make a very difficult decision. And I think we could level or remove part of that anxiety if they see that everyone is working together, because these are not the mayor's schools, they're not my schools, these are the community's schools. And this should be a community responsibility. Parents, teachers, elected officials, all working together to say that we in New York City are doing everything in our power to keep each and every one of our school communities safe. So I'd now like to introduce some of our panelists, coalition folks who are here today. And I want to thank first the medical experts who have helped me and the union throughout this process when we said that we understand that New York City needs to try to open its schools, but at the same time we have to do everything in our power that we do not start this spread of this virus once again. This city went through hell and came back, and we are not going back to hell because of short-sighted political agendas. So I'd now like to introduce Dr. Jackie Moline, the Vice President of Occupational Medicine and Epidemiology and Prevention at Northwell University, to speak to our plan. Thank you, Doctor, for being here.
Thank you, Michael. It's a pleasure to be here, and I'd like to talk about workplace safety and health. Now, this isn't the first time that we've been involved in school situations where there have been health issues, whether it was tuberculosis, whether it was Operation Clean House with asbestos, whether it was lead in the schools, whether it was dealing with H1N1, dealing with Ebola and concerns for those communities, particularly in Staten Island. Now we have COVID-19. You know, one of the tenets of occupational medicine is its prevention. And the prevention is through a strong plan that has the elements to protect everyone going into a school. Michael said something to me several months ago on a phone call where we were having a conversation with folks from the mayor's office and a number of different health professionals. And he said, we are working to keep clusters of people away from congregating. Yet when we think about opening the schools, we are sending hundreds of people into an enclosed environment. And so we need to think about the safety rigor that has to be in place in order to ensure a safe school for our staff, for the teachers, and anyone who might come in from the community. We talked about making sure that the ventilation is appropriate, and there are guidelines that have been set forth on what needs to be done to make sure that the physical plant is optimal in each school. Making sure there's appropriate PPE. Being in healthcare, of course, we understand the role of PPE and have been dealing with both shortages and the necessity and seeing how it can protect and save lives. We need to ensure that there's an adequate supply and that people are trained in how to use it properly. You can't just throw people masks without making sure that they know how to wear it appropriately and what are the appropriate scenarios for different folks having different levels of personal protective equipment. There also needs to be comprehensive testing and, most importantly, contact tracing to ensure that anyone who may have symptoms are followed up so that the spread might be mitigated in a community. We've seen recently that a rush without a plan, whether it's the University of North Carolina, whether it's Notre Dame, whether it's schools in Indiana that opened and closed the same day, or schools in Georgia, where school children returned to school. There were rates of disease because no one was tested before they went in, and the schools were closed that day. What we need to do is have a comprehensive plan that will cover all the bases so that the schools are safe for our children, for the staff, the teachers, and that we can give the best education to everyone free of fear. Thank you.
Thank you, Dr. Moline, and really, again, thank you for all your assistance. I'd now like to ask Dr. Mark Jarrett, the Deputy Chief Medical Officer for Northwell Health, to address what we are presenting here today. Thank you, Dr. Jarrett.
Thank you for inviting me to be on this panel. We all recognize what happened, as stated before by Michael, in March and April, and certainly on a personal level, in what is a longer professional career than I want to admit, this was the hardest thing I've ever dealt with, and I do not want to go back to those months again in terms of our communities. We all want to open the schools. We are all parents or grandparents and recognize what it means to keep children out of school. Yet this is not just a school issue. This is a public health issue. And I say that because a resurgence that can occur because of this has greater impact outside the school buildings as well as in the school buildings. Clearly, we want to keep our children and our staff safe. There is more and more evidence now, in fact, the WHO said this morning, about increasing spread due to people in the ages of 20 to 40 who are asymptomatic and spread the disease, and we certainly know that children may not be symptomatic and spread the disease. So it is not just whether children will catch it, like they all get colds during the fall and the winter. It's the fact that they're going to bring those home. And when they bring it home, it could be to their parents, it could be to their elderly grandparents, and thus spreads from one to the other, and results in, quite frankly, catastrophic illnesses for people who have various comorbidities or elderly or have diabetes and other medical problems. So this goes beyond the four walls of the schools. Clearly, we want to keep, as I said, our staff and the staff of the schools as well as the children safe. That is our prime responsibility. But it is also our responsibility to the rest of New York. We do not, nor can we afford another resurgence. We have had such a hard hit in the spring, and if you walk around the city and see how many closed businesses there are, how many people have been hurt economically, this is really tremendous impact on us, and we need to figure out a way to get back to normal, but we don't want to slip further backwards, which will make it even harder. And especially it hurts sometimes the communities that are most vulnerable, which makes it even worse. So I think that coming up with a plan that we all can agree on, that we feel is safe, will never be perfect. There will be spread sometimes in the schools. This is an infectious disease. That's the reality. But to have ways to mitigate that spread, ways to quickly close certain areas, close maybe a classroom or a whole school, and have a methodology in advance, as said by Dr. Moline, so that we're not just trying to figure out what to do when the emergency happens, but to plan for it, because we know what's going to happen. That is really the key in this, and that will hopefully not only allow parents to feel comfortable sending their children to school, allow schools to continue, but also protect the rest of the community in New York City. Thank you.
Thank you so much, Dr. Jarrett. I'd now like to ask Dr. Michael Minner, and I want to thank him also for taking the time to do this and for giving us his guidance. He is the Assistant Professor of Epidemiology at the Harvard School of Public Health. Thank you, Dr. Minner, again for your guidance and for being here today.
Hello, everyone. I'm sorry, we're having a little bit of trouble being able to hear.
We can hear you. You're fine. We can hear you.
What's that?
We can hear you.
Okay, great. I'm an assistant professor of epidemiology. I generally have been working in the coronavirus sort of response mode since January, February. And I just, in the capacity here, I think that the efforts that are being laid out, they're certainly going to be, these are pretty tremendous times, and there are tremendous activities going on to try to keep the schools safe. And I think throughout this, I'm happy to take questions that anyone might have, and I can speak towards any of the individual components of the program that are being laid out. But in general, I think that things like antibody testing and getting people tested on a routine basis are going to be particularly important to ensure the safety of the schools as they begin to open up. And I'm happy to take questions if there are others as we go along.
Okay, thank you so much, Dr. Minna. We will be doing questions shortly. And now I'd like to ask someone who's been a staunch advocate of the children, especially the special needs children in New York City, one of the leading parent advocates of the city school system. Gloria Corsino is the co-president in the Citywide Council on Special Education, and I thank her again for taking the time to be here today and for endorsing what we are asking the city to now adopt. All right, you're on mute. All right, is it her or us? It's her. Gloria, you have to unmute.
Sorry.
That's fine.
I was talking to myself. Good morning.
Good morning.
This pandemic, as it has hit everyone else, has affected children of all school age, but children of District 75 is the most vulnerable students have had the most regression. I am the proud mother of 2 special needs children, and the regression is real. I had shared with Mr. Harmon yesterday that the blessing that I have had with my children's educators, their paras, the staff, has been amazing. My children's educators took it upon themselves after class to come visit my children. They wanted to make sure that my children did not feel abandoned, that they did not feel that they were lost in the system. Their engagement was key to making sure that they needed to see my children as much as my children needed to see them. And that went above and beyond their call or responsibility, and I'm grateful for that. As a parent, it speaks volumes to what we feel. I, like anybody else, wants my children back in the school building. It's essential. It's a need for them. It's a need for everyone. But I also want everyone to be safe, including the people who are educating my children. I would never want to jeopardize anyone's safety, let alone my children. I want the truth like you guys do. I want the staff to have the proper protective equipment, because if they're protected, my children are protected. I want the school buildings to have proper ventilation. I want everything to be in working order before I allow the most precious gifts that I have to walk into any school building. And I think I speak for every parent when I say that. This is not, we're not, you guys and parents are not asking anything that's unreasonable. You're asking for the safety of everyone that has to work collaboratively. And I want to champion that for parents and from this perspective, and we need to work collaboratively so that everyone is safe in that building. I had also offered that I think as stakeholders, we'd love to be part of that walkthrough to make sure that whatever you're saying is not there, we can see as well, and who can better support that than parents who have been educated on what walkthroughs look like. So I'm advocating to be part of that, please. I'm here.
You have it.
Please make sure that we have a seat at the table. We'd like to make sure that we are speaking truth to power with you guys, because it's important for our children. It's important for the staff that work with our children. So please, we are imploring you to include us in that so that we can help you guys.
Thank you, Gloria. And of course, we didn't want to have to ask you to do some of the work we had to, but as always, you are welcome, and we will welcome all the parents who want to work with us to do this work in terms of getting our schools ready. Thank you. I'd now like to bring Randy Weingarten to the microphone, because this really, over the last 2 weeks, it became clear to us that New York City was going down the same path as so many other school districts, and that was the last thing that we wanted to do. And we knew it became more and more of an imperative that we go out and push everyone to understand that parents and teachers do not want do not want what is happening in all of the school districts we're seeing across the country happening here in New York City. And I want to thank her for her leadership in fighting with parents and teachers all across this country. But I also want to thank you for being a friend always to this union and for taking your time today to be here.
Thank you, Michael. And you know, this is this is part of this new normal where Michael and some of the medical staff are, you know, at the U of T, and so many of us are on Zoom. But I want to actually kind of lead off with how the U of T has been leading in this. As many of you know, I hate sharing screens, so I'll do it this way. We, in April, put together this plan about how to reopen schools because, as Michael said, particularly in New York, no one wanted to repeat the chaos that happened as schools had closed and the fact that there had been no real national leadership in particular in terms of this whole crisis. The UFT was indispensable in putting this plan together. The UFT has been working since April on trying to figure out how to reopen schools, how to do something in a way that really worked, as our amazing parent just said, that would really work for children, would work for educators. And frankly, before all of the resurgence of the disease, we could see around the country that 75% of our members said if we could get the safety standards that Mike Mulgrew and the UFT had as part of that report card, they would be comfortable going back into school. Well, we know what happened since. The mishandling continued. Donald Trump decided to throw a wrench into all of the planning and failed to do any of the work in terms of resources. And now what you're seeing is over 60% in a Peterson poll today, not one you would call a liberal poll. In a Peterson poll today, over 60% of parents and teachers say that they were very concerned about school reopenings because of, as Michael said, what has happened in the last few weeks. And over 81% of parents and the public, and you can see this throughout, it's Democrats, it's Republicans, it's independents, it's people of color and people who are white. It is almost unanimous in the United States that 81% of the people say we need to actually make sure that we can keep things safe. That is more important than reopening anything. So what do we do in this situation? That's why what the UFT has proposed here right now is so important and so profound. They have three basic issues here. One, obviously, was the community, the community spread, which Governor Cuomo and others have talked about. Two is this safety report card, which others have talked about. But third is this point that the doctors and Michael Mulgrew and others have talked about today, which is so important, that kind of robust testing, tracing, and isolation situation. Because without it, even if you open, how do you stay open? That's what just happened in terms of the University of North Carolina. That's what just happened in terms of Notre Dame. So you have to have a system that actually, particularly given that this disease is so asymptomatic and spreads so asymptomatically, as the doctors have just said, you have to have a system where we can actually see and know the data, see and know who is infected and who is not infected. And if you don't do that, you will never know until it's too late. And then when it's too late, it becomes a little outbreak, becomes a surge, as we have seen in the South and the Southwest. Is this my opinion? No. I'm a social studies teacher and a lawyer. I listen to experts. I listen to the experts that are on the phone that are at the UFT, the doctors that are there. I also look at evidence. And if you look at South Korea, you see that evidence. We could say we shoulda, coulda. This is going to be an issue in terms of the election about whether or not Donald Trump mishandled this. I believe he has. I believe the voters will see that. But right now, it's not, it is what it is. It is what we need to do about it right now to ensure that we can educate children and keep people safe. And that requires that kind of testing, tracing system. That is exactly what South Korea did. And yes, when they have a little, when they have some outbreak, as the doctors have said, this is not risk-free. What they do is they can handle it because they have this kind of robust testing, tracing, and surveillance system. Does this cost money? Yes, it costs money. And if LA can figure out how to find the money to do it, New York City can figure out how to find the money to do it. It's not about having a hotline. It's about following the science. So if it's important to open schools, we have to do it gradually, we have to do it responsibly, we have to do it safely, and we have to have this kind of testing, tracing, and isolation process that Michael and the UFT has proposed. I applaud them for doing this. It is state of the art, and it is the only way we are going to be able to be safe and educate children. Thank you, Michael.
Thank you, Randy, very much. I'd now like to ask a person who, first and foremost, is a New York City public school parent, but is also in his role as controller of New York City, gets to look at both sides, gets to see it from the viewpoint of the parent, as well as someone who understands what the community is truly crying out for in terms of transparency and a real plan. I'd like to bring Scott Stringer up to the microphone.
Thank you very much, Michael. For the last several weeks, I've had the opportunity to hear from parents across the city via Zoom conference, virtual town hall meetings, with parents who are worried about their kids and the safety of our schools this fall. Parents who are frontline workers, parents with pre-existing health conditions, parents who are desperate to know whether their kids will be kept healthy and safe. And that's the first question I hear from parents. Is it safe? And more importantly, can we make it safe? And right now, those questions had remained unanswered. We've said that we need clarity and creativity from City Hall. But City Hall hasn't stepped up to the plate. And the reality is we have been waiting for these answers for too long. With just weeks to go to open schools, we need to have a plan. And we need to have a plan that we can all get behind. Today, the UFT Mike Mulgrew plan is a real roadmap to safety with testing and protocols and actual people on the ground to keep our kids safe. We know the challenges that teachers face. They've risked their lives in the midst of this pandemic. They're frontline workers, and they love our kids more than anything. And right now, I really wish a chancellor and a mayor were here today announcing this plan. But the fact that all the advocates, Speaker Johnson, and so many others are joined together to say, let's give this plan a shot. Let's really take it to the powerful interests and say once and for all, we care about our kids' safety, we care about parents, we care about teachers. And I'm very excited because as a parent of a public school kids, a third grader to be and a second grader to be, I worry about this every day. Can the most precious people in my life be safe? And I've thought a lot about this plan, and I've talked a lot with the UFT about this plan. And I am hopeful that we could adopt something this rigorous to give our kids an education they deserve, to fight this pandemic. So I just want to say to Randy Weingarten, to the health experts, to Michael, who I know has had many sleepless nights putting this plan together, we need to get City Hall to step up right now, to give us clarity, to give us the plan, to take the best of your science and health and make a difference right now. I'm really proud to be here today with all of you, proud to be here with Michael and the UFT and all the stakeholders who care so much about our precious kids. Thank you.
Thank you very much, Scott. I'd now like to bring up someone who's been a staunch supporter of our schools and has led us through some really treacherous times recently with all of the financial problems the city is now facing, the funding shortages that the school system is facing. All of these things fall squarely onto this man's shoulders. So I'd like to have Corey Johnson address all of us here today. Thank you, Corey, for being here, and thank you for being a leader in these tough times.
Thank you, Michael. I think you just called on me. I'm having a little bit of a hard time hearing you, but thank you. Good morning, everyone. I'm Corey Johnson, Speaker of the New York City Council, and I'm really honored to join this group this morning to talk about what is going to happen in the next few weeks for New York City schools and for the 1.1 million children who rely on our schools and the amazing teachers that teach every single day and that had a really arduous final few months of last school year at the height of COVID-19 in New York City. I want to thank UFT President Michael Mulgrew for organizing this and bringing us together. Michael has been a leader on countless critical issues throughout our city, especially during this really challenging time for our students, teachers, and families. He understands that we rise and fall together, and the UFT understands that when we talk about schools, we're not just talking about teachers and students alone, we're talking about the entire school community, custodians and cafeteria workers, parents and grandparents and siblings. And this is why the safety reviews and testing protocols that have been put forth by the UFT, by medical experts that are on this panel today, and by parent and community groups are so important. We know that back in March, there were mistakes that were made, and I don't pin that on anyone, but there were mistakes that were made. We just have to make sure that we do not repeat some of those mistakes that happened back in March. Schools needed to be closed, but the advice of experts were not always done with urgent action or were sometimes delayed. And we know that COVID-19 was already circulating throughout our schools at that time. Countless teachers and staff and students and their family members were exposed. And we have to make sure that nothing reckless happens moving forward. The sounds of nonstop ambulance sirens are still too fresh in the minds of many New Yorkers. And we have done a good job as a city collectively at keeping our numbers low over the last many months. We have to make sure we continue to do that. We cannot ignore those hard-won lessons, so we have to make sure we do this safely. Safety must come first, and that means delaying in-person schooling until appropriate safety measures are not just talked about, but are actually implemented. I just want to end by saying that the UFT and also the Principals Union and so many of the parent leaders and the folks that have been on this call today want school to open. We are not saying do not open school. We are saying let's make sure we do it safely and smartly. It is deeply upsetting, honestly, that so many children have not been able to be connected with their school communities and with their peers over the last few months of school, but we know that it was done for safety reasons. And what we needed to be doing over the last many months since schools closed down in March is to come up with an individual plan for every single individual school building in New York City to give parents peace of mind, to give teachers peace of mind, to give those school communities peace of mind. And so much of this revolves around rapid testing protocols for the entire school community to make sure that the ventilation systems are working appropriately throughout those schools, that social distancing is possible. I know the Comptroller Stringer has been talking about outdoor spaces during the warm months in schoolyards and other places to be able to have more adequate space for children. So this is the work that we know will allow us to open up our schools safely and effectively. This is about getting to a place to open schools, not about throwing up obstacles. No one is looking to throw up obstacles. We are looking to be able to do this safely, to give people peace of mind, and to make sure that everyone is safe. Children and students, teachers, custodians, cafeteria workers, principals, assistant principals, paras, everyone who is in a school, we want them to be safe. So I want to thank you, Michael, for the hard work you've put into this plan. I want to thank Randy Weingarten for her national leadership on this every single day, talking about what's happening all across the country. And my hope is that New York City will be a model. We will be the model for the rest of the country to show folks that we can do this safely. We can have social distancing. We can make sure that we are listening to the input of school communities and to the workforce. So I want to thank you, Michael. Thanks for having me today. I look forward to continuing to support the safety around this plan by listening to experts who are weighing in and telling us how to do that. And with that, I turn it back to you.
Thank you very much, Corey. We appreciate the kind words. And I'm now going to ask each of our three community leaders, but please don't thank me. This is all of us together. This is really hard stuff, and I appreciate and I thank you all for taking part of this process right now. So I want to bring up someone who has always stood by the parents and the teachers and all the communities of New York City and been a fierce fighter. Fierce, and has always said that the public schools are the most important commodity of our city. I want to bring to you, I would like the president of the NAACP New York State Conference, Ms. Hazel Dukes, to address us. Thank you, Hazel, for taking the time and being here.
Thank you very much. Can you hear me?
Yes, we can.
Thank you very much, and I am absolutely honored to join with so many of my friends, and let me give a real shout out to the speaker, Corey Johnson, and the city council members, Denise Miller, who assisted NAACP in this trying time of making sure that some of our children that had not had the resources they need, especially the computers and tablets, for what they did for us with discretionary funds this year. So thank you again, Speaker Johnson. Let me say to Randy Weingarten, my sister, and to Michael, we have worked on so many issues on education through the years. We've had our difference of opinion, but our focus have always been our children. Several months ago, Anthony Harmon, who's one of the presidents of the 15 branches we have throughout New York City in every borough, we came together and we put together a NAACP education task force that was at the end of March. And we looked at and had parents calling the office, and we put a proposal together. We submitted it to the governor of the state of New York and to the mayor and the chancellor. I am so disappointed to report we have never received an acknowledgement of the proposal that we submitted. That was thorough. It started with health. It started with the resources, all they need. We have never had an acknowledgement from the mayor or the chancellor of the city of New York. We've heard from Dan Fuller at the state level. We've heard from Commissioner Rosa. And so today I come on behalf of the 15 branches in New York City opposing anything that the mayor would say about opening our schools. He have not presented a plan to this community and to our parents. Survey is full of junk. We don't do surveys well. And so today I join here saying that the plan that we have put together, Michael Mulgrew have looked at our plan and reviewed. We didn't say it was the best thing since sliced bread, but we are saying we are offering something. So sit at the table with us, as the parents say, include us. We represent. We are in every community. We are in the New York City Housing Authority. We are there. We talk to people. We hear them. There are too many unanswered questions for us to say that we are going to open New York City schools. We will not, because if we open them on a Monday, I guarantee you on Monday afternoon we are saying we're closing up. So I joined today. I heard the medical experts, which is great. I've heard from the elected officials. I've heard from the parents. Now it's time for the mayor and the chancellor to hear from us before they make a decision on opening schools. You're right. We all want our children back in school. We are all concerned about the education of our children. When we think about the kids who are in foster care, we think about the kids with disabilities, when we think about the kids who are in the shelters, there are too many unanswered questions on the safety, on the health, and the learning of our children that we can support opening New York City schools. I am not happy with remote learning. There are a myriad of problems there. I don't know whether they have been corrected because we don't have any answers. We have no data to say what the mayor get on TV and say every morning. That's not good enough for me. I'm intelligent. When the Randy can show her proposal, when the UFT can show theirs, and the NAACP can show theirs with data, with hard facts, then we deserve, as New Yorkers, for the mayor and the chancellor to do the same to all of us. So thank you for inviting me to participate, and I'm here to support our children, our workers, our teachers, our custodian, our cafeteria workers, all the people that make up for quality and good education for our children.
Thank you, Hazel Dukes. As always, you just make sure everybody understands exactly what is going on, so I do appreciate it. And I want to be clear before we get to our last two speakers, there is so much more the school system still has to do, but we can't, for the mayor or the chancellor or anyone to be talking about all of the other things that have to be done without first addressing the safety issue. That is why we are having nothing but chaos out in the schools at this moment. Principals have received very little instruction, no clear directions, have been sent surveys to send to the state. We still don't have a program in place to make sure that every single child will be remotely hooked up, because no matter what we do this year, every child will have a portion of their instruction will be done remotely, and all of that. We have no plan in place for all of those things, but we can't do any of that until we first have an assurance of safety. And then making sure that all of those children, there has to be inventories at each and every school, that every child has translation services or assistive devices in case of their disabilities or the challenges they face here in the city. All of that is standing still because we still haven't solved the safety issue. So I'd like to bring up the Executive Director of the New York Immigration Coalition and thank him for being here, Mr. Stephen Choi.
Thank you, Mike. And I just want to say how honored I am to be standing with such amazing champions and allies from across the field. I stand here today because we are in a period where New York's immigrant communities have been devastated by this pandemic. Immigrant families have been hit so hard by COVID-19. Immigrant neighborhoods have seen so much of the death and illness that COVID has wrought upon New York City. There are thousands of people in our communities, in immigrant communities, who have died, tens of thousands who've gotten sick. So we absolutely need to be mindful of the health and safety of the city's immigrant communities. Also, immigrant kids and immigrant families in our school system have been so disadvantaged in this moment. And we're not just talking about some kids. This is most New York City kids. Nearly half of New York City students speak a language other than English at home. So we're talking about millions of students and millions of immigrant families. And those kids deserve a shot, an equal shot at a quality education in a safe environment. And so we need to be thinking about all the challenges in the situation, not only by parents and families potentially getting sick and dying, but also by the challenges of the situation. The achievement gap between kids is threatening to yawn even wider. And so I want to be clear. I want to join Hazel. I want to join so many other people. We're all aligned on this call because we all want schools to be open. We want them to be open as soon as possible and as soon as practical. Immigrant kids have been affected deeply and negatively by this period of remote learning. The achievement gap is getting bigger, and so many immigrant families don't have a child care safety net during the day. More than half of our frontline essential workers are immigrant New Yorkers. But we are all aligned today. We join with our allies to say we must do more. We have to do more before schools reopen. We need to make sure that all of our key elements are actually in place. And we love the plan that Mike is putting out there to make sure that immigrant families and youth, that teachers, school leaders, and staff are safe, and that everyone feels prepared going back to school. And we just don't have that right now. And I just want to highlight another piece. Another part of ensuring real safety and being prepared to open is having a system that's in place that is quick and efficient to get information out to immigrant communities, out to immigrant families in their home language. They need to be informed as soon as other parents are informed, and that is not happening. And we need to also make sure that input from immigrant families is going into the system as well. Throughout the pandemic, there's been a major, major challenge getting immigrant families information. How are you going to make schools safe for immigrant families if you're not getting information out to them and you're not hearing from them? The digital divide and language access barriers have led to so much confusion among immigrant families. And so communication by the DOE, by the city to immigrant families, hearing that back from them, that's a critical part of any safety plan. And the city just needs to do more. We've had some progress. I think everybody will tell you here on this call, we've had some progress, but the city needs to do more. And we're at a critical moment right now. So we are proud to join with our allies. We're proud to join with our champions, proud to join with the UFT in delivering this message to Mayor de Blasio and to Chancellor Carranza. We need to do more before we actually do this. Thank you.
Thank you so much, Stephen. I really do appreciate it. To Reverend Foy, I'm sorry, but I kept you to last on purpose because I thought it was important, and at this point in time, I'm ready to do anything that needs to be done to keep our children safe. So the organization, the Arc of Justice, which you have founded, but more importantly, I'm trying to do anything that could help us. So if you can bring the good Lord to apply to bring some wisdom on people in this city and help us try to get through this endeavor, I would have greatly appreciated it. I know it's inappropriate probably for me to ask you to do that in a public setting, but I want to thank you for what you've been doing here across the city, but more importantly for being here today. Thank you so much, Reverend Foy.
Well, I want to thank you, Mike, for your exceptional leadership in this very trying time. You know, our teachers have always been a resource, not just an educational resource, but an emotional resource and a moral resource. I remember tragedy after tragedy where the teachers were on the front line comforting our fallen and comforting survivors. I remember marching with Randy after the Pulse massacre. I remember marching with you, Mike. I remember the teachers joining hand in hand with the community in every crisis that we face. And as always, we face another crisis, and our teachers are stepping up in the absence of real clear vision and leadership coming out of City Hall. Our mayor was elected promising to end the tale of two cities, and here he has given us a tale of two school systems. It is unacceptable to ask that our essential workers put their children on the front lines with no plan, sending their kids to schools with no plan, sending their children into harm's way with no confidence that the city is prepared to protect them and provide a secure and safe environment. I'm grateful that you and the UFT have stepped up and provided a plan that parents can be confident in. I'm not just an activist, I'm a parent of two public school kids, grade school kids, and quite frankly, my wife and I have decided we're not prepared to send our children back into those school buildings. And it's not because we don't trust the staff or we don't trust our teachers, but there is no trust in the leadership. In the absence of a real plan, we cannot sacrifice our children or put them on a coronavirus yo-yo. We can't ask our kids to get ready to go back into an environment that they have been missing and longing for, only to have that rug ripped out from under them prematurely because we didn't plan. And now we have to shut the schools down again sooner than we had hoped. The UFT has provided a plan that parents can be confident in. If we, as a city, can come together and set ego aside, if we can come together and put public health above economics, then we can pull together. We can provide our students with the education that they are in need of and deserve. We can provide our teachers and our professional educators with the environment, the safety that they deserve. We cannot afford to lose another teacher. We cannot afford to lose any more students. There are still very many unanswered questions about how this virus impacts young people. And so we cannot turn our schools into biological research facilities where we are asking our children to expose themselves to dangers that we can't measure at this time. It is time for us to take a step back, as your plan calls for. It is time for us to assess where we are, building by building, facility by facility. It is time to instill in the parents the confidence that they need, to encourage the parents with data and with a confident plan of action should an outbreak occur, should a child or a professional come back positive, that this situation won't balloon out of control. These are questions that parents have, they're concerns that they have, and they are not concerns and questions that have been answered by City Hall, but yet, once again, our teachers have stepped up. And as a parent, I say thank you. As a father and a husband, I say thank you to our teachers for what you have done, for the remarkable job that you did transitioning into remote learning. It wasn't perfect, but the intent was there, the will was there, and the commitment of our teachers was there, and I'm grateful for it. I would just close on this one last point. COVID has quite clearly impacted communities of color in a disproportionate manner. We need to make sure that does not bear true for our children, where we have asked the essential workers of our city, the people of color of our city, to bear the heaviest burdens of COVID. And now we're going to ask their children to bear the heaviest burdens in the name of ego play, in the name of economic expediency. It's not going to happen on our watch. I'm grateful for your leadership. We are prepared to do whatever is necessary to ensure that the city reopens schools under nothing less than the safest conditions humanly possible. And that's not going to happen absent the implementation of the UFT plan. So we're with you, Brother Mike. We're with you all the way. We're with you, Randy. We're together in this. If we're not going to reopen our schools safely and securely for all of our students, we're not going to reopen our schools safely and securely for anyone. And the mayor needs to understand the resolve of the UFT. They need to understand the resolve of the civil rights community and the activist community. And but most important, they need to understand the resolve of the parents of the 1.1 million students in the New York City school system. We're not going to let you play politics with our children. We draw the line of political games and gamesmanship and brinksmanship. We draw the line around our children. It's a bright red line, Mr. Mayor, and you're going to respect it. Either you're going to respect it through force of our will, or you're going to respect it through reason and rationality. But one way or another, Mr. Mayor, you are going to respect the will of our parents and our educators as we protect our children from what has been the most devastating and traumatic time in modern American history. And we're not going to allow ego and political expediency to inflict further trauma on our teachers, our educators, and indeed our children.
Thank you, Reverend Foy. Appreciate the strong words and all of the support on behalf of the teachers of New York City. So we're now going to start our question period. And before I take a first question, I will answer one that I know I'm definitely going to get.
You've been watching a press conference by the United Federation of Teachers on the new school year in New York City. Coming up next, CBS 2 News at noon. Stay tuned.